Hey, Dr. Matt, good afternoon.
Hey, how are you? How are
I'm
you?
I'm good today. How about you?
Doing good. Doing real good.
Woo!
Been a long week, busy week.
Long week, busy week. We do apologize to our viewers, but I can't come on until the man is ready. I mean, I can't give you COVID-19 updates, and he's extremely busy these days. So, but thank you all for joining us again today. Of course, I'm April Garner, Network founder, and this is Dr. Winston D. McIver Jr., practice owner of Waccamaw Primary Care, and we are coming to you live as always on Fridays, 4 o'clock-ish. 4 o'clock-ish, okay, to give you these COVID-19 updates. And so, Dr. Mack has done a really good job of pulling together some research in between time and in the meantime as he's caring for patients and trying to make sure everyone stays safe through this COVID crisis. So, Dr. Mack, you want to say good afternoon to all of the viewers?
Good afternoon. Good afternoon. Good afternoon.
All right.
Yeah, how's everybody doing? Hope everybody's doing well.
Yes, hope everyone is doing well. Absolutely. Just want to remind you that if you have any questions or comments during this segment, please post them to Facebook on the stream that you're watching right now. Good afternoon, Tanya Jones. Thank you so much for tuning in every single week. We appreciate you so much. I believe Tanya's in New York. Is that correct? I think she's in New York. Yeah. So thank you so much. Make sure that you post your comments and questions. We're going to cover a good bit of data today, and then also just address a few things that have come up in just community conversations that we've seen in and about social media. So typically, Dr. Matt will kick us off with some numbers that he has in terms of cases and deaths and, even some positive numbers that he tends to give us in terms of people who've recovered from COVID. And I know you want to hear that information as well. And once we're done with that, we'll probably get into some of the great graphs and charts that he has, pulling from DHEC and a few reputable media sources that we pretty much resource or source every single week. Bonnie Edie, thank you so much for joining us. We appreciate you. And so, Dr. Matt, whenever you're ready, you can begin with your numbers and then just let me know when you're ready to see the slides.
Okay. We'll start off with the numbers as we usually do. This really is a reflection over the past 7 days since we talked last Friday. Worldwide, the number of positive cases have gone from 19.5 million to around 21.2 million number of cases. The number of deaths have gone from 720,000 to over 760,000 deaths worldwide. In the United States, the number of cases have gone from a little over 5 million to about 5.4 million. And the number of deaths in the United States have gone from 163,000 to over 171,000 now in the United States. South Carolina, in the past week, the number of cases have gone from a little over 98,000 to a little over 104,000 positive cases. And in last week, we've had about 200 more deaths in the state of South Carolina, going from approximately 2,000 to a little over 2,200. Getting into the states in our area, getting into the counties in our area, of course, Horry County has gone from around 8,300 cases to almost 8,800 cases in Horry County. And the number of deaths in the last week in Horry County have gone up 20, from 141 to 161. Georgetown County, the number of cases have gone from 1,300 up to right at 1,500 over the last week. County has gone from, and the number of deaths in Georgetown County in the last week has gone from 18 to 25. Rounding out the counties in our area, Marion County has gone from 535 confirmed cases to 576, and the number of deaths have gone from 13 to 14 in Marion County. Now, I have to say this before we get into the graphs. All these number of cases that we have, we do feel like are not an accurate assessment of what's going on. There have been a number of community case testing sites that have been established and that were done that are lagging significantly on when we get the results back, including the number of just overall community testing in the last week to 10 days has reduced as well. So we do know some of the hospitals were really kind of burning it up with doing a number of tests, 2, 3, 4 weeks ago, but that has kind of slowed down some to a degree. So that may be a reflection too of some of these numbers that we're hearing about going down. I hope the numbers are going down, but most physicians feel like the numbers of positive cases are likely going down, more so because there hasn't quite been as much testing going on in the community, and because there's been somewhat of a backlog in the state lab and these outside labs getting the results back. So that's one of the things that we talk about. Specifically with the slides, slide number 1. Okay, so on this one, this is a very important slide, okay? And the gist of this slide is really concerning because it has to do with the deaths, okay? And so since July the 21st, there's only been 5 days since July 21st where there have been less than 1,000 deaths in the United States. Now, to kind of make that make sense, or to kind of put that in perspective, on last Wednesday, there was about 1,500 COVID deaths in the United States. That's the equivalent of 8 737 aircrafts crashing. Let me say that again. These numbers are staggering when you think about it. All that thousand on the far right, that line going across, any numbers above that means there's greater than 1,000 deaths in the United States. So let me say this: on last Wednesday, there was over 1,500 COVID deaths. That's the equivalent of 8 737 aircrafts crashing and everybody dying on board. Staggering numbers of people that are dying. And we knew that would happen because the number of hospitalizations were going up. So hence, there were going to be more people that were going to be dying compared. So that's very important to understand that these numbers need to go down. And we'll talk about goals to reopen in just a little bit. But I just wanted to start off with this to see that these numbers are staying consistently above 1,000. And that's deaths per day in the United States. Next slide. Also, this is in the United States. It's hospitalizations. So what's happened is that we see that these things are going in peaks as far as the hospitalizations. Again, it's kind of doing a what we call a bimodal presentation here, which means it's peaking and going down. That has a lot to do with people that are being infected and to the point where they have to be hospitalized. Now, the curve is going down, which is a good thing. But again, we still have Labor Day coming up. So we'll have to see how these numbers look in regards to that. Next slide. New cases. These are how the new cases are looking. We talked about that earlier. This is United States. They are coming down, it appears. But again, we don't know if that's because there's a backlog in some of the labs, and there's not as much testing that's being done. And we'll talk about that in a little while too, with the goals to reopen. Next slide. We just talked about this. So this 1,500 was the deadliest day during the summer of COVID-19 deaths. We just talked about that. So again, it's important to watch the number of deaths. Hospitalizations are a key indicator, but the number of deaths per day is a key indicator too. And we're talking about consistently now since July the 21st of being over 1,000 deaths per day. Next slide. South Carolina specifically, as I said, we're right at 104,000 cases and right at 2,200 deaths. And this graph shows the increase that corresponds with those numbers. Next slide. This is a cumulative map of South Carolina, which basically shows where the highest number of cases as of the 12th of August. This is from DHEC. And you see the states that are in the darker blue report a total of over 3,000 cases. And then as it gets lighter, it's less cases. Just can I kind of keep it in perspective as we see the Greenville area, Columbia area, Charleston area, and Horry County area are typically leading in that parameter. Next. South Carolina, this is DHEC data. There have been 100, right at 104,000, as we said. Negative tests are right at 702. Hospitalization, there have been a total of right around 6,500 hospitalized. Currently, there's a little over 1,300 hospitalized, all due to COVID-19. Next slide. Okay, this is a 2-week cumulative incidence report. How common is and how often we're seeing it. The darker the blue, the more common. The lighter the blue, the less common. Horry County is starting to drop off some, but again, the question comes back in, is that because some of these community tests that have been done, it's been a little bit slower getting the data back, in addition to some of the facilities that were doing a lot of mass testing have kind of slowed down a little bit for whatever reason, have slowed down a little bit over the last week to 10 days. So that's something still to be kind of seen and to watch out for. Okay, next slide. Again, these are South Carolina. As I said, the graph to the left has to do with the new cases. The graph to the right has to do with the deaths. Again, the interesting thing is the graph to the left, that drop off, we just got to kind of see what that means. Is that because we still got a bunch of tests that are pending, or is it because the numbers are truly going down? And only time will really tell that. So again, I did want to give this for all candor. I don't want to give all bad news because it's not all bad, but I do want to make us aware that, you know, a graph and a number and a statistic can say a number of different things. So just kind of looking at what it means and kind of following it will be very interesting over the next 2 to 6 weeks. Next slide. Okay. Demographics. Again, the average age of a COVID-19 positive patient is right at 42 years old. The median age is right at 40. And that's kind of how the DHEC is reported based off of age. Next slide. This is reported cases. And again, that far green line, I mean, that's a huge drop off like that. And the concern is when you see a huge drop off and it's not really a stair step, is that all the data may not be there. This is COVID cases reported week by week. And so again, you would expect it and you would hope it to drop off. But when you see that much of a drop off, it tells you that either the number of people that have gotten tested here recently has dropped off, and or the results are lagging in coming back in. So again, I feel like this is an incomplete graph, to be honest with you, but I want to go ahead and just put it in to show that that's where we are when we talk about the numbers are getting better. We don't know if it's truly getting better, or if people just aren't testing as frequently, or if it's just taking the test long to come back. So again, it's probably a combination of all of that, but this is a graph that I'll be watching and stats that I'll be watching real closely over the next 2 to 6 weeks. Still, the bulk of the people are under 50 that are getting it. If you're talking about, 4%, 11%, that's 15, 30, 45, 60% of people are under the age of 50. So again, this kind of is the age ranges that DHEC is looking at it as far as who's testing positive, not deaths, but positive tests per age group. Again, the younger people are getting it. And thank God, most of them are making it through and living, but they are still the belief is that they're still passing on to the older folks or folks that have compromised immune systems. So we still have to follow this graph as well, but it's been pretty consistent as far as who's testing positive. Next slide. Okay, so a couple things. In April, we can kind of come back to this if we need to, because there's a couple points I want to see if there's there's any questions that people may have so far. Okay. We can come back to those last two in just a minute. Okay. So, I'll come back to those last two in a minute. Okay.
Okay. All right. So did you want to stay on the slide you were talking about, or where do you want to go with this?
Well, I want to see if there were any questions. Is there any questions?
Oh, I don't see. Yeah, I don't see any. I couldn't talk because I'm in the background, but I don't see any questions right now unless you see some in the thread.
Okay. All right.
Yeah. So you want to go back to that?
Let's go back to that.
Okay.
Okay. So a couple things that I want to kind of highlight here. The first thing is when we're talking about goals to reopen. There's about 5 main goals that were established to kind of let areas, states know if they're ready to reopen. And when you look at all of the parameters that were put in place initially by the CDC and initially by the WHO, only 6 states have met all 5 of the goals. Only 6. Okay. And we'll go by each of the goals specifically. So the first goal was simply talking about 2-week drop off in cases. So one of the biggest issues that was talked about initially was to say, the question was, how do we know when we're out of this pandemic? How do we know when it's safe for states to open up? And the initial thing was having 2 weeks.
Dr. Matt, you're buffering a little bit. Hopefully you'll catch up with us in just a moment.
2 consecutive weeks.
Dr. Mack, I think you fell off a little bit. And you stopped with how do we know when it's safe? And then it started buffering. Can you go back to that?
I can. So the first parameter to look at for goals of reopening is having a 2-week drop off in cases. Okay. And a 5% drop off in cases compared to the previous week. So there were hard numbers that were put into play initially about when is it safe to reopen. Okay. And it was 2 consecutive weeks with greater than a 5% drop off compared to the prior week. So we haven't really met that. Some states have, but a number of states have not. Most states have not. So that's the first goal, a 2-week drop off in cases. The second goal was low numbers of new daily cases. In other words, the number that the CDC gave initially was having less than 4 new cases per 100,000 residents. Whenever in medicine and statistics, we talk about numbers, we typically talk about it in terms of cases per 100,000. So that way you can start to try to compare apples to apples. In other words, if you've got an area that has only has 25,000, you can extrapolate the numbers to make everything equal to 100,000. So that way you're comparing apples to apples. So the second goal to open was having decreased daily numbers, ideally less than 4 new cases per day per 100,000. There's only 6 states that have met that, are meeting that now. Connecticut, Maine, New Hampshire, New Jersey, New York, and Vermont. Now, again, New York has a number of cases, but they have a larger population. Mm-hmm. So that's how you can kind of make apples to apples when you're looking at per 100,000 residents. Okay. The third thing is having a high coronavirus testing capacity. In other words, you have at least 150 tests per day per 100,000 people. In other words, are you testing the way that you should be testing? And there's a number that kind of says, well, yes, this area is testing sufficiently. This area is testing sufficiently to catch a number of people who have COVID-19.
Have they set a statewide number, or does it vary from county to county?
It very well. They look at it state and they look at it county, but we're not there.
Okay.
We're not there. And so remember, for the longest when we first started talking, it was we were kind of like less than 1% of the population in the state for a while. That's 5%. Then it started ramping up, but we're still not where we need to be testing.
Right.
Okay. So that's kind of where we are. That's important, but because of course if you know what areas, what counties, what states are testing more, then you have a better idea of what the true representation is of that state as far as COVID case. The fourth thing is a low positivity rate. And I know we talked about positivity rates before. South Carolina's been running anywhere between, 15 to 22%. A low positivity rate is considered less than 5%. Less than 10% is decent, but less than 5% positivity would be ideal. That means less than 5% of people who get tested are positive. So that's a positivity rate. So that's important because that also gives you an indicator of how widespread this is in the particular area.
And once again, we have not met that, is what you're saying.
Right. Now, I'll give you an estimate because remember when we talked before and we said for every one person that's positive, it's probably 7 to 12 more people that are positive and don't know about it. Well, DHEC put out numbers, and specifically with Horry County, like I said, there's about and this data is actually from last week, but it's about 8,700. The estimation is that it's probably about 50,000 people in Horry County that have it. Georgetown County, like I said, there was about right at 1,500 people that were positive. It's estimated there's probably about 9,000 people in Georgetown County that are positive. And this is not my data. This is DHEC's data.
DHEC's.
I'm not picking this up. This is DHEC's data. In Marion County, it was 570 people that were reported positive. They estimate it's probably about 3,500 people that are truly positive. The others just haven't gotten tested or their test results aren't back yet. So that's very important to understand those numbers. Now, I know it was just reported that there were 71 new cases in Horry County and 53 new cases in Florence County today. That was just resulted. Again, there's a number of these tests, April, that are backlogged.
Oh, I know. I
so when you see these, I showed that graph and it had that green bar to the right. We knew that's not accurate. That's too fast of a drop off. So you expect to see it more in a stair-step fashion. So that's what we're kind of looking for. And that's why I said that part is still to be determined on that. Okay. And the fifth parameter for goals to reopen is availability of ICU beds, intensive care units. Ideally, you'd want to have less than 60% occupancy rate of an ICU bed. Okay. And there's still scores of states that have higher than 60% capacity in ICUs. So that's another parameter to show, because the more ICU beds that are filled up in a specific area, the likelihood is that it's going to be, more disease in that area. So those are really the 5 parameters that we're looking at that was initially out, that has been kind of tweaked, kind of looked at to see whether or not states are really, really ready to open up. 2-week drop off, decrease in the number of new daily cases, increase in testing capacity, decrease in positivity rate, and availability of ICU beds.
And as you said, out of these 5 parameters or criteria, we haven't met any of them yet.
Well, we've met a couple of them.
Okay.
We met the well, at point in times we met them. So let me say
Okay.
it that way.
So it's kind of bobbing up and yeah.
Right. It's a fluid thing. So
Right.
that's the thing with it.
Okay.
So when that happens, it kind of makes it more fluid and more labile.
Which makes it extremely hard for them to actually make sound decisions that are going to be sustainable because everything is changing. It's constantly changing.
It's tough. It's tough. You know, the other issue is too, is I was just reading this article about, you know, and this is not to talk about East Carolina University because I know it's happening everywhere, but they had multiple parties on East Carolina's campus, including one party that had over 400 people. So if the parents aren't taking it seriously, the quote unquote leadership's not taking it seriously, you would pretty much expect that the kids aren't going to take it seriously because they have this invincibility type mentality anyway. So that's one major concern with these schools opening back up and these parties and get-togethers and all this kind of stuff happening is a major concern. Okay. So it's a few more points I want to make, and then we'll see if there's any questions. Number one, there's still this question and this concern about diabetics with COVID. Okay. We're still seeing increased numbers of diabetic patients that are having significant problems with COVID who have diabetes. We're seeing a number of patients that are still having issues that have sleep apnea or any kind of lung condition. I'm now hitting over 60 patients, about 65 patients to be exact, that have had COVID-19 that I've seen. I had one patient that came into me who after the 14 days was hospitalized, ICU, ventilator, all that. But prior to that, had tested positive for COVID. At day 14, when that person was pretty much told that they were out of quarantine, this is before they became my patient, they developed a blood clot. So we do know that the clotting nature of COVID is real. That's where the heart attacks are coming from. That's where the strokes are coming from. That's where the blood clots in the lungs and in the heart are coming from. That's where the amputation of legs and feet are coming from. It appears to be a coagulable condition. In other words, the cells coagulate or clump together to increase the chances of having blood clots. So that's one point. One other point before we go to questions is that the zip code data has been re-released, and right now the 29588 zip code in Myrtle Beach, what I think is Socastee, if I'm not mistaken, is that Socastee?
29588.
Yeah.
That's
that County Forest.
No, it's a little past the overpass in Myrtle Beach. I think that's about where it starts because I remember my old place of employment was 29588.
Right.
Off
so
of the frontage road. Exactly.
So out of the 534 zip codes in South Carolina, three of the top 9 are in Horry County. That 29588 zip code is number 5 in the state. In the last month, the increase has gone up 42%. The next would be the Myrtle Beach zip code 29579. That's number 8. It's gone up 34%. 34% in the last month since July 13th. Yeah, somebody said 29588 is Socastee. Okay.
Socastee.
All of that too, off of front over Socastee.
It's wide, must be. Okay.
Right. And the number 9 is Conway zip code. It's up 48% since July the 13th.
Which zip code is that?
29526.
29526. Okay.
It's up 48% since July the 13th. Now I think a lot of that increase has to do with the fact that there were a lot of community testing that has been done in Conway.
Right.
It's taking a little bit longer for those results to come back, but I think that's where that's coming from. So the number 5, the number 8, and then the number 9. Out of 534 zip codes in South Carolina, we have 5, 8, and 9 in Horry County. All of them have gone up between 34 and 48% in the last month. And they usually look at those data, that data month to month.
Well, I'm looking at, I know you're talking zip codes. I'm looking at this newly released data from DHEC that I just sent you a link to it, the report that came out at 2:00. And the new confirmed cases by county, the top 5 counties are Charleston County, Richland County, Greenville, Horry, and Florence. Right.
So what's happened is Florence has made a significant increase and Richland has made a significant increase. Greenville, Charleston has always been steady, 1, 2. Horry County was 3 for a while, but last week Richland was right on the heels of Horry County and they surpassed. Now that's for cases. You also have to look at it, that's for total cases. You also have to look at it for active cases and deaths. And so that information should be released today also. So it's 3 parameters that they look at, April: total cases, active cases, and deaths. And for the longest, it's been Charleston, Greenville, and Horry. But Richland was gaining. The biggest jumps, though, have been Florence County. And again, that could simply be because they're doing more testing in the area.
Absolutely. Okay. Can we come off with the slides now?
Yeah.
All right. So, and I think that the testing is one of the biggest concerns, one of the biggest areas that appears to be, I'm not going to call it flawed, but definitely delayed, which is probably causing these numbers to be so significantly skewed. And we don't know how that's going to adjust itself or what's going to happen because, in the grand scheme of things, yes, everyone is offering the testing sites and free testing, drive-through, and all that good stuff. But we can't ignore the fact that while this may be happening in some of the larger cities and in bigger areas, in the rural communities, we don't know whether or not it's really happening. And there was a question brought up prior to the show about, well, it wasn't really a question. It was more about it was a question about the testing. But this particular person actually experienced going to an institution and had a test done that was a finger stick test and received the results almost immediately. I think she said within 30 minutes. And so I wanted us to address that as well because of, we want to make sure that people understand not only the validity of the test, but what they're actually interpreting from certain tests to make sure that they're getting the right information.
Right. So in other words, there are a number of companies that have been given the okay for these rapid tests. A lot of them are antigen tests, which basically looks at proteins from the virus. Okay. The PCR test, which is a swab, which people have been doing, looks at actual particles of the virus. But the antigen test looks at protein particles. So again, what happens is those tests are good for rapid tests, but if a person's still having symptoms, they probably should get the actual viral PCR test. Again, it's good because those are called point of care tests. In other words, you can go in fast, get them, just like if you went to the doctor and got a pregnancy test or a rapid strep test or a rapid flu test. They typically pick up particles of whatever you're looking for. Again, you're still talking about most of those tests having a sensitivity and specificity of 85 to 90%. So as far as the tests go, they typically are decent tests, but it's not like what the PCR where it's more of an accurate test. I'm not knocking it because the point of care tests are going to have a role in what's going on. Okay. For example, a lot of sports arenas, where you're testing athletes, they'd want 2 and sometimes even 3 of those tests to come back negative in a certain amount of time. Okay. And again, we're talking about, 85, 82, 85%, 82, 91%. Somebody asked about the false positive rates. I mean, we're talking about 80, high 80s to low 90s, which are still decent, but it's not going to be 100%. And people need to know that. So again, you still have to go on your gut instinct on how you feel.
Okay. There's a question in the thread before we go to break from one of our viewers, and he asks, can we trust people to give the correct information? There's so many people wanting to put our children back in school, as well as reopening, not to speak of the sheriff down in Florida that's forbidden workers to wear the mask. So can we trust these numbers?
Well, I mean, it is what it is. We can only report what we got. I mean, I've said, 20 weeks we've been doing this now? I said the whole while from every time that the numbers are not going to be accurate.
They're not going to be spot on. They're not going to be 100%.
But again, it gives you some idea of what's going on. Again, there are a lot of people that are dying at home. I mean, I knew somebody that just died this week that I knew that died from a blood clot and had tested negative for COVID. Tested negative for COVID, but had pneumonia and ended up dying from a blood clot. That person probably had COVID. So again, you can take the data how it is with the understanding that the numbers are probably higher. I know the numbers are definitely higher from that chart that I showed you earlier with the total number of cases where it just did that big drop off. So we definitely know that. I see there's another question about blood clotting. So again, this part is still being researched, but it is clear that this looks like it's a coagulopathy type condition. In other words, it will make the blood thicker. It will make it thicker. And so that appears to be the mechanism where people are having heart attacks, strokes, blood clots in the lungs, and ended up having amputation in legs. Now, there's a big question about taking anti-inflammatories while you have COVID-19. So again, we don't really recommend that right now. I mean, there's still some data that still has to come out. There's still research being done. But again, that's part of the reason why when a person has COVID, they're given steroids to try to help cut the inflammation down. Steroids are anti-inflammatory. That's how they work. That's their role in this. Whereas the other medicines like the remdesivir and those medicines are antivirals. Again, it's not going to be for everybody. It's not going to work for everybody. Thank God the majority of people who have this are getting better, but there are going to be people that won't get better, unfortunately.
Actress Alyssa Milano stated that one of the side effects from her bout with COVID was that she was losing hair. And so if we can touch on some of the after effects a little bit, Doc, I don't know that we really talked about that other than we might have touched on it at some point. But, I know that there's been reports that people who have recovered from COVID are really, well, some of them are struggling in terms of the after effects. And I know you said early on that we at the time, we didn't really know what those after effects were and what people would be experiencing down the road. I know there was a friend of mine, a social media friend of mine who this week was hospitalized, actually had an emergency room visit, and I think stayed in a couple of days because he was having heart issues and it was showing up as like a palpitation or of some sort. And they wanted to basically rule it out as a heart attack. And they even considered giving him a stent and all that. Luckily, he didn't have to have that, but he was convinced that all of this was a result of his bout with COVID. So, what are some of the more pronounced side effects or even things that people may not expect that could possibly happen?
Okay. So we talked about the hair loss. Okay. That's called alopecia. So what happens is anytime a person has any kind of stress or sickness on the body, they can have alopecia. So that's not just unique to COVID. It's just unique to having an infection, particularly large, overwhelming infections, whether it be bacterial, viral, or fungal.
Mm-hmm.
That's more of a factor of the sickness and the stress on the body.
Okay. All right. And so any other side effects, or is that, or after effects, not side effects, but after effects?
Memory has been a big one. There have been a number of people that have talked about memory. There have been people that have been having other neurologic effects, such as off balance and just feeling like they're kind of, woozy, lightheaded, off balance.
Mm-hmm.
Certainly the cough, certainly the shortness of breath, certainly the chronic fatigue. There was a study that was done. It wasn't published. It was more of a peer review study that just talked about the number of people who have just this chronic fatigue, this overwhelming fatigue months after testing positive for COVID. Mm-hmm. Certainly the loss of taste and smell, for some people can be ongoing. I've got a patient now that's over 4 months with loss of taste and smell.
Yeah, I've read someone say that too, that they have not regained their sense of taste. And it's been months since they dealt with COVID as well.
Right. There's a question about the heart.
Yeah.
Okay. Yeah. So this is some of the newest stuff that's come out now, particularly in the world of sports medicine, which is where I am a large part of the time, where we're finding this condition called myocarditis, where there's inflammation in the muscle of the heart. And so now it's pretty much a given now that any athlete that has COVID is going to get some kind of cardiac workup and some kind of cardiac testing. It's still kind of unclear as to how in depth that needs to be, but certainly an EKG, certainly following up with your primary care doctor to talk about it, particularly if you're having worsening of shortness of breath, worsening of fatigue. It could possibly be heart related. Again, it's not going to be everybody, and I'd venture to say it's going to be less than probably 30% of people, less than 20% probably even. But again, if you're still having prolonged effects, that's something that should be in your physician's mind. Mm-hmm. With my patients that have COVID, I'm checking with them weekly. Mm-hmm. They're having weekly visits with me. Mm-hmm. And the first question relates to lungs, breathing, and heart.
Absolutely.
You see, stuff has gotten worse.
Mm-hmm. So, things that are, I guess, a little bit more on the controversial side, we definitely don't want to, I guess, dismiss any conversation there and questions and comments that people may have. It's just worth a conversation, as a lot of other things that are popping up right now in the media and on social media as well. But there's a comment about a supposed whistleblower who states that people are dying of COVID, but it stated that there was other issues, which was the cause of death, and vice versa. So again, going back to the truth in reporting, I've seen that kind of report a lot, whereas people will say, well, my relative went in for maybe it was a heart or a lung issue or whatever the case is, and they supposedly died of a heart attack, but they listed it as COVID. And I think from all of our discussions over these weeks, and even what you're talking about today, we're talking about underlying causes and underlying reasons. There may be a primary reason, but something that exacerbates it or whatever the case is. So I think people need to just be mindful of, number one, the source of the information, but also number two, and the fact that all someone on social media needs to see is one article that they truly believe in, and then the cut and paste devils happen, and then it gets circulated. But talk about the how underlying causes, or how COVID could be an underlying cause, if not seen as a primary cause. And I think you just touched upon it a few minutes ago, but really explain that so that when people hear this type of story, that there's I guess there should be a sense that there could be some truth to it. You can't dismiss it entirely.
Okay, so what happens is that it's well established now that COVID-19 is a multi-organ condition. It's going to affect multiple organs. The older the person is, the more sickly they are, the more problems they have. Okay. I've had patients that have been in the hospital that had blood clot at the same time, ICU, blood clots, on the ventilator, on dialysis, and having the possible amputations, being concerned about having an amputation. So it appears to affect multiple organs. So let's talk about a few of them real quick. Couple arteries that come off of the main artery in the body called the aorta that go to the kidneys. The kidneys are reliant on that blood flow from the aorta so that the kidneys can function well. If there's clotting going on in the aorta or in the renal or kidney arteries, that kidney will not get the proper blood flow, hence not the proper oxygen, hence that kidney will start failing. So that's the mechanism in a nutshell. And believe me, I simplified that real
I'm sure
for purposes of this talk, but
right.
Simply stated, that's what happens. It's not enough adequate blood flow. The oxygen is in the blood. So if the blood flow is not there, the oxygen is not there. If the cells don't get the oxygen, the cells will start to die. Hence, the organ will start to malfunction. That's the pathophysiology from a person with COVID going on to dialysis. Okay. Likewise, in the heart and the brain. There are arteries that go to those organs that require constant pressure to get the blood flow, hence the oxygen. If the heart doesn't get that blood flow, it's not getting the oxygen. Hence, those cells will get ischemic, decreased blood flow. Those heart cells will die, hence a heart attack. Mm-hmm. Same mechanism with the brain. If the brain doesn't get the adequate blood flow, that person will have a stroke. Same mechanism in the feet. If the adequate blood flow and oxygen doesn't go to those tissues will start to die and that person will get decreased blood flow. Hence, they can get gangrene. So that's the mechanism behind it. It appears to be all an inflammatory mechanism. Now, taking that a step further, diabetes is an inflammatory type condition. Asthma, COPD, emphysema are inflammatory type conditions. Those things all take major hits when you already got so much inflammatory cells circling around in the blood vessels. Mm-hmm. So that's the mechanism of each of those organs. The liver,
yeah. So how it relates to COVID-19 being considered the underlying issue if something happens. What I know you just described kind of the anatomy of it all, but it is quite possible that something could be more of a primary cause, but COVID be underneath it, which is why it might be listed.
Right. Right. So what happens is a lot of people, when they're admitted to the hospital, they're admitted with suspected or pneumonia, suspected COVID-19. And again, when a lot of these hospitals weren't able to turn the lab test around, that was the working diagnosis based off of the symptoms patients had. Mm-hmm. That was the working diagnosis. So that's why on some of these death certificates, it may say probable or it may say suspected COVID-19.
Okay. All right. Well, Doc, we're going to take a little 30-second break and then we'll come back. There are a couple of questions that are in the flow and I want to make sure that we get to them. And also just remind our viewers, please share this post as a watch party or just, to your page so that everyone can get this great information from Dr. Winston McIver Jr. And also your comments and questions, if you have any, especially as it relates to a lot of things that are going to be happening the next couple of weeks. We have a public school and colleges reopening. Please post your questions or comments if you have any questions about what you should do in terms of taking precautions to get your children and yourselves ready for school. So we'll take a really quick break and we'll be right back. right, Dr. Mack, we're back. And so, again, we want to thank all of our viewers for tuning in today, watching us, and for sharing the post across your social media. We do appreciate it. And of course, our broadcasts are always available for replay, either on social media, and I'm also posting it to YouTube, and we'll have YouTube links available if there's a previous broadcast that you would like to see, just to kind of refresh your memory about some of the things that we've talked about over the past 20 weeks or so. So Dolores Rozier, of course, she's one of the community activists in Horry County, and on top of a lot of things, political, educational, and otherwise, she thanks you, of course, Dr. McIver, for the information, but definitely has a question about test results. There appears to be major differences in the length of time for testing results in certain communities. The range of time is sometimes from 30 minutes to 2 weeks. Many folks in minority communities are waiting 2 weeks. Why the time gap in certain areas? And could it be an access issue, just an access issue, or maybe even
That's part of it. That's a very good question. The other issue, I think, is that some of the labs that these community testers are using are not major labs. They're smaller labs, and the smaller labs don't have the same rapid testing capabilities that larger labs would have. Heck, even the larger labs are having problems turning around some of these tests now. So I would imagine the smaller labs would have even a bigger issue. The two biggest labs in the country are Quest Labs and LabCorp. Mm-hmm. And so they've been having issues turning these labs around in a fast and timely manner. So I can imagine, small independent labs so where you've got to send it to, let's say if you're getting tested in South Carolina, but you've got to send it to Atlanta, it's going to take them some time, because the odds are it's somebody else somewhere else in some other community is using that same small independent lab. So that's the issue. And like we said earlier, and I think I said this last week, is that with these community testing, they need to find out who these labs are, and they need to look at sources, recommendations to see who else this lab has worked with and what's been their experience with the turnaround time. Because you're right. I mean, about 2 weeks ago, I had patients that called me. I was like, look, doc, it's been over 2 weeks since I got the test and I still don't have the results. Well, that blows contact tracing out of the water.
Right.
Because and it makes it dangerous, because if that person isn't quarantining for 2 weeks and they're still out and about in the community, they're out and about potentially spreading COVID-19.
And basically, if a person has been exposed, they know they've been exposed, or there's a strong possibility or a probability that they've been exposed, they need to go ahead and self-quarantine anyway, even if they don't have the test results back.
But the problem is, April, you're right. But the problem is a number of these people aren't having symptoms.
So they think they're out of the woods or not affected. Yeah,
exactly. Now, let me say one other thing too before we get, because I don't want to forget this, because this is very important. If you're wearing a mask and this mask has a vent to it, throw that mask away, because you're not protecting anybody. The mask that you have should not have a vent to it.
You mean like the little pieces that are kind of make it look fat?
That mask is a one-way valve. It's not allowing stuff to come in, but it's allowing you to blow stuff out. You get what I'm saying?
Okay.
So in the medical world, we call those selfish masks. Okay? Because your mask is supposed to be there to prevent you from passing it to other people. That valve, that vent, is a one-way vent that allows air to go out. It'll stop it from coming in. So yeah, you're protected, but you're not protecting anybody else, because your call for whatever is going
out. Okay.
And the other part of it is the fenestrations, or the gaps in that vent makes the particles that come out even smaller. The smaller the particles, the farther it can go. Now, I'll take it a step further. I've seen a number of people wear these things, and I don't know what you call them.
Gators.
Gators. throw that mess away.
Mm-hmm.
Because what's happened is they just did a study at Duke on that, showing that those fenestrations in those gators make the particles even smaller and make them come out faster and going farther. The smaller the particle, the farther it can go, the lighter it is.
Right. So, guys, gators are the ones that you just kind of pull over your head, and you can pull them up this way over your face.
Throw that away. Throw that away. Because that's not even protecting you. It's certainly not protecting the other person, but that's not even protecting you. Now, again, it's better than nothing.
Mm-hmm.
But if we're trying to be good stewards, that's not helping. But those masks with those vents in them, those air holes and those ports in them, they're pushing stuff out. Okay? So I want to make that clear. In medicine, we call those selfish masks.
Mm. Okay. All
okay.
Right. Next question. This is a very important question. What are some safety precautions for two people living in a home where one person has tested positive, or maybe a family and, multiple people in the family have tested positive, but, maybe there's one person in the family who has to be there out of necessity to help the others? What are some safety precautions?
That person that's positive needs to be in strict isolation for 14 days. They need to be in their room, isolated from everybody for 14 days. Okay. And everybody that lives in that house should get tested, because that's an exposure. Okay.
Plain and simple.
Just that simple. If they're positive, they need to be out of everybody else's eyesight, out of everybody else's presence.
What if you have the person, two people in the home, and one person has to care for the other? What can that person do to make sure that they are protected?
Well, it depends on what you mean by care. They definitely need to wear a mask. If the person is totally dependent on somebody else, then the person who's a caretaker needs to mask up, glove up, maybe even eye protector up, and make sure that whatever clothes they go in there with, they take them off before leaving that room or as they're leaving the room.
That's a lot.
Oh, it's a whole lot.
That's a whole lot. I can't even imagine what hospital healthcare workers have to do if they're, oh my goodness. So yeah. So basically, if the person is able to walk, go make their own sandwich, do whatever, you need to let them care for themselves.
They need to stay in the room, though.
They need to stay in the room.
Right. And if they just have to come out the room, you make sure that you clean those areas that they touched, and make sure that the person who's caring for the person, when they're wearing gloves in there, they take those gloves out before they come out. Because if they're in there touching stuff with the gloves on and they leave the gloves on, they're going to go out and touch a knob somewhere and potentially put COVID on a knob or a counter or a refrigerator door handle or that kind of thing.
Kind of best that hopefully the persons that are affected have at least one room that has an attached bathroom or something, so that person can use that bathroom only. Right. And I just had like a total movie visual in my mind of the person who's caring for the other person, the sick person, sliding their food to the door and leaving it at the door for the person. I mean, how do you do that?
Hey, you gotta do what you gotta do.
By any means necessary.
That's right. That's right. That's right.
Okay.
And that's not far-fetched.
Wow. No, it's okay. All right. Well, I tell you what, it's in a nutshell, Doc, is it getting better? Are the cases going down? Is it getting better? Is it enough for us to stop worrying about it? Or are we just kind of like in a place where we still need to be as cautious as we've ever been and not let our guard down? Because I was trying to find the article that I read earlier this week where it was kind of contradictory in a sense, but it was saying we're still in a hot spot, but the virus is slowing down. And I'm like, well, which is it?
Well, the concern about the virus slowing down is getting these results from these tests.
Right.
So, again, a number can say anything you want it to say. But I can't say it's necessarily slowing down until I know and I feel comfortable that these tests are being resulted in an adequate time period. So first of all, you can't say that. But the telltale sign here is that people are still dying. I showed in that one graph before. Since July 21st, there's been 4 days but there have been less than 1,000 people die.
Yep.
Last Wednesday, there was 1,500 deaths. That's the equivalent of 8 737 aircrafts crashing and everybody dying in one day. So imagine pretty much since July 31st, we've had anywhere between 6 to 8 737s crashing every day. That's what's happening. Now, granted, the majority of these people are not kids. Granted, the majority of these people are older folks with chronic medical conditions. But the problem is, especially in certain communities, you've got multi-generations living in a household. You've got the child, the parent, and the grandparent living in the household. And that's where the real concern is, particularly now with school starting back.
Yes.
So I've got a hospice patient who's got young kids, and the conversation we had when I did the hospice visit was, Doc, what do you think about my kids going back to school? I mean, this hospice patient has some very real, very serious problems, but by the way, has 2 young kids. I said, don't let them go back to school. Not right now anyway, because if they go home and they get it and they bring it to you, we got some real problems.
Yeah.
We're going to have some real problems, particularly with the conditions that this person has.
Exactly. I know there are a couple of people who just tuned in. So real quick, Doc, and of course, I'm taking notes as you're talking. I just want to go over the 5 things in terms of the criteria that need to be met for us to understand what is happening with the coronavirus spread. And number 1, you said 2 weeks of a drop off in cases. That's how we'll possibly know when it's safe. And we haven't met that yet.
That was the first criteria that the CDC actually put out, that the White House actually kind of dismissed. 2 consecutive weeks of dropping numbers in a particular area, state, what have you. That was the initial one. Again, the second one would be a decrease in the daily number of new cases. Ideally, it would be less than 4 daily new cases per 100,000 people. That kind of equalizes and make you could talk, compare apples to apples. Because it's hard to compare, Richmond, Virginia to Conway, South Carolina, unless you have some way of standardizing the number and extrapolating the number. And so in medicine, in the statistics, we typically talk about per 100,000.
Right. Okay. And you said that there were only 5 states that have actually kind of done that, and that's Connecticut, Maine, New Hampshire, New Jersey, and Vermont.
And New York.
And New York, okay, so 6. New York. Okay, all right. Then number 3, high coronavirus testing
capacity, right?
Capacity.
So you want to be able to test at least 150 tests per day per 100,000 people. Again, that's a mouthful that I just said, but what it's saying, in other words, is you just got to have a high testing capacity. And that way, that gives you adequate and accurate information as to what's likely going on in your community. If you've got a county with 500,000 people, but you're testing only 60 a day or 80 a day, that's nowhere near where it needs to be. So that's number 3. Number 4 is having a decreased positivity rate. In other words, the number of people that are positive compared to how many were tested.
You said that needs to be less than 5%.
It should be less than 5%. South Carolina, we're running anywhere between 15 to 22, 13 to 21.
Okay. And then the availability of ICU beds needs to be less than 60%.
Less than 60%. So if you've got areas that ICU capacity is higher than 60%, that area has a problem. That area is not getting better. Now, the problem is the hospital data is now going to Health and Human Services in Maryland, D.C., and not the CDC.
Right.
So again, but again, this, at least South Carolina has been doing a pretty decent job of keeping those numbers available at the places where it needs to be.
All right. So there's a question about teachers and school staff safety. Of course, we know we're getting ready to get on the bus, unfortunately, for some. But Celia Crosland asks, what suggestions do you have for teachers and school staff for their personal safety?
Lots of hand sanitizer, encouraging distancing as much as you can. Again, the way we determine in contact tracing a close contact is closer than 6 feet for longer than 15 minutes. So that's kind of a mindset that the viewers need to understand and need to have, is that close contact, by definition, is considered less than 6 feet for more than 15 minutes.
That was that time and proximity we talked about last week.
Exactly.
Mm-hmm.
Exactly.
You know what? We should issue a pop quiz on. And if your mom was watching, I'm sure she'd appreciate that. But on this information that we're given each week, we should do a pop quiz. Yeah, that was the time and proximity talk, which opened my eyes a lot.
Very important for contact tracing. That's one of the hallmarks for contact tracing is time and proximity. Because when I have patients that test positive, that's the first question that I'm really asking them. Who were you around and how long were you around them? Mm-hmm. How close were you to them?
Mm-hmm. Okay.
There's a question about vaccines. Yeah. There's this thing that was published about Russia coming out with this vaccine. I wouldn't take it. It takes vaccines, 5 to 10 years. Now, again, there will be a vaccine that will be out. I would imagine probably early 2021. And they may even try to push this before the end of this calendar year. But again, it takes time for vaccines to develop. There's a lot of issues around vaccines, a lot of concern around vaccines, who's pushing the vaccine. Some of the people that are pushing the vaccine are talking about population control. And I really don't want to get into that right now. Mm-hmm. But again, there will be a vaccine that will come out. I don't anticipate any vaccine coming out that I would be comfortable with before 2021.
I think it's just interesting that they're, pushing the vaccine, but not really pushing the testing part of it so much. Seems like that's where they would put the concentration.
Well, it's a political thing. And when the president says, the reason we got positive tests is because we're testing. That's just like saying the only reason we know somebody's pregnant is because they do a pregnancy test. Mm. I mean, it's crazy to have that mentality of just stop testing. That's his take on it. Just stop testing. Well, stopping testing isn't going to make this go away. Again, the virus is the constant. We're the variable. Mm-hmm. The virus is going to be here as long as we don't do what we're supposed to do. And as a matter of fact, I don't want to be the bearer of bad news, but we're going to be talking COVID-19 in 2021. Mm-hmm.
I believe
we're going to be talking about COVID-19 in 2022. Now, I don't think it'll be as disruptive. I don't think it'll be as destructive as it is right now, because again, this is novel. Nobody has really built up any kind of immunity to anything close to this. Mm-hmm. But this isn't just going to go away. I think I said a couple weeks ago when the Spanish flu happened and flu vaccines were instituted in the 30s and 40s, the initial thought was that within 2 decades, we wouldn't be talking about the flu at all. Well, as we see, we still get flu vaccines still there. So I don't think this is going anywhere. I think COVID will just be added to the vaccines that will be recommended, such as the flu, such as pneumonia, such as shingles. Mm-hmm. Yeah, I think it'll just be another vaccine.
Yeah. This is the virus we're seeing in our lifetime that is doing the things that other viruses have done in the past. And we're making history, of course, by being a part of this, but also by, watching how our government officials are handling it, how the medical experts are handling it, and what's taking place as far as what's being asked of, the people that it's impacting. And so you're right, nothing is going to happen overnight. And it's kind of irresponsible for people to expect things to happen overnight, especially when everyone is saying, and this word has been used 1,000 times, 1,000,000 times, it's unprecedented. So we're not going to have the quick fix for it, which is another reason why people should be very, very cautious about anybody who's pushing a solution, a vaccine, a treatment, or whatever. It's just it's besides me. I don't know why some people are so on that bandwagon, other than they just want to believe that it's just not as bad as it seems. And yes, it's, can be fixed just like anything else.
At the rate we're going, and the University of Washington, Johns Hopkins, and the World Health Organization have been on point with this numbers so far that we're seeing. And it was staggering to me when I saw some of these numbers. I was like, there's no way this could happen. We're on a pace for 230,000 people to be dead by the end of this calendar year.
That's almost 250,000 people.
Yes.
Dead from COVID-19.
Yes. We're on that kind of pace. We're on that kind of pace.
Yeah. Very, very sobering. Should be anyway.
It's mind blowing to me. So I try to make these analogies to make people kind of understand what it is that doctors are thinking and what I'm thinking. So I put a post on social media the other day, and it was this. I had a conversation with somebody, and they said, well, Doc, I don't really understand what the big deal about this is. Only 2% of people are dying. I said, well, think about it this way. I'm going to give you a bucket of jelly beans. It has 100 jelly beans in it, but I'm going to tell you 2 of them are poisonous. I guarantee you wouldn't deal with those jelly beans.
That's right.
She said, you got a point. It's still 2%.
Still the odds there.
2% of jelly beans that's in there. I wouldn't eat those jelly beans.
Correct.
Most people, if I tell you that it's a 2% chance that you're going to get one of these jelly beans and it's going to kill you, you probably going to leave those jelly beans alone.
And some of us don't have good luck. So
right.
Stay away from that jar. Yeah, don't have that kind of luck.
Right. So 2% of people is still a lot of people.
That's right.
That's still a lot of people. And, we're talking about now over 170,000. That's a city.
That's right.
That's a city that's wiped out.
That's right.
Sorry, Sean, I won't mention about an airplane anymore. Sean said he's about to get on an airplane.
I saw that. Exactly.
He's my man from way back, so I won't talk about that. But I have to kind of look at giving you real life scenarios and try to make it visible, so to speak. That's a lot of people. You're talking about over 1,000 people a day dying.
You're trying to give them something they can possibly relate to.
Right.
Yeah. Yeah, I agree, Dr. Mack. I mean, we have to try and educate in any way possible. And if we have to use visual aids or mental aids of creating visual pictures in your minds, and that's what we have to do. I think that a lot of our viewers realize how serious the situation is, but it's so frustrating when you listen to others or you see posts from other people who just, they refuse to get it. It feels like, sometimes we're doing this in vain, but I'm not going to believe that. I'm going to believe that the people who are watching are the ones who are especially cautious. And I'm sure they're trying to re-educate people or even educate them based upon what you're giving us every single week. So, we're just going to have to keep doing what we're doing and try to create these visual aids and relatable scenarios and anecdotes so that people hopefully will continue to heed your messages. But while you're looking for comments, I've been trying to go across the threads as well to see if there's any other comments. I just want to make mention of a few things that are coming up over the next week or so. So, of course, you all know that I'm also a part of the Whittemore Community Magazine, and we are currently in the midst of our 2020 Summer Enrichment literacy initiative that is co-sponsored by the Whittemore Community Magazine and several community partners. And so just want to talk to you all about what happened last Saturday. It was a beautiful, beautiful launch of one of the very first literacy initiatives that we put together in less than 2 weeks, basically. And if Ms. McIver, I know you're watching, I can't remember the final number of participants we had, but we had almost 30 participants signed up, and just about everybody was present on last Saturday as the initial launch of that particular reading initiative. We're reading Ghost Boys and having discussions, and the teens are in the midst of some activities that will result in a culminating project at the end of the month, and possibly by September 5th they will be done. But we also are taking donations to support these young people and what they're doing, reading this book over the next 4 or 5 weeks, working on some serious activities that will lead to more of an understanding of social justice issues, racial issues, things that definitely are a part of our plight, in these days and times still. And so just want to thank everyone who put a lot of hard work into pulling it all together. The team consisted of partners from the Whittemore Community Magazine. And like I said, community partners, Marjorie McIver, Marlo Frazier, Hannah Sands McIver. And then we, of course, had the McQueens, who are responsible for the Whittemore Community Magazine, and Janara Falk, who is also a part of the Whittemore Community Magazine. So I don't know if we're still taking signups for the 8 to 12 group, but this Saturday we will launch the initiative with our 8 to 12 year old group, which is our 3rd to 5th graders. They're reading the same book, and they have activities as well. And the great thing about it is that the donations that we're receiving, we will be able to issue monetary stipends to these young people to help them get ready for school. Ms. McIver reports that there are 32 who participated last week, and that is awesome, considering, it's kind of hard to get young people to sign up, especially to, sit and read a book, but they all seem to be so engrossed in the reading. And I think by the time we meet with them, as a matter of fact, on tomorrow, we will know more about their understanding of the content, and we'll be able to discuss some issues with a great historical lesson coming from Sister Joella McQueen. Also want to talk about the fact that for Whittemore Community Magazine over the next couple of weeks, and I'm going to put these topics out there and these special guests. Of course, they're subject to change based upon people's schedules. But on this coming Monday, we're going to have our part 2 of the genealogy discussion with Grant Mishu. I don't know if you all remember or not, but a couple of weeks ago, we had Kevin Mishu, Grant Mishu, Ms. Mary Owens. We also had Frankie Weaver, and who else? I can't remember who else was on there with us. Anyway, we were all talking about the Edie Lake project, the cemetery project, and what they're doing to preserve that particular sacred ground, how it relates to the ancestry and buck sport. Grant Mishu, who found out through his ancestry and genealogy work that he's related to Kevin Mishu. He's a cousin. He is doing some fabulous work with the Gullah Society. Every time Grant and I are on the phone, a 5-minute conversation turns into almost an hour. And so, or even longer. We talked today, as a matter of fact, about something special that they're working on down in Charleston. And so we're going to continue that genealogy talk on Monday at 7:00 on the Whittemore Community Magazine. He's going to talk about some of the ancestry tests, like 23andMe, Ancestry.com, whether or not the results of those tests are valid. He's going to also discuss Black cemeteries, and if your church has a Black cemetery, what that could mean in terms of the history of that land, the possibilities that exist on the grounds of that particular cemetery. There's been numerous reports from just his work that, some of the cemeteries that we think may contain 1 or 2 or 3 graves may actually contain 100 or more. And you just never know how our ancestors were buried back in the day. But there's some traceable information and things that he's able to share with us. And I know that a lot of you wanted a part 2 of this so that you could understand how to trace your family tree, how to find out more from your DNA. I have my 23andMe test, and I'm going to pull it out, and we'll talk about that. So On Monday, this coming Monday, the 17th at 7 p.m., we'll have Grant Mishu with a genealogy discussion, DNA discussion, and talking about Black cemeteries. On the 24th, which is the following Monday, we are supposed to have, I think it's confirmed, but we're going to have Luke Rankin on the Whittemore Community Magazine, and we'll talk to him about some of the things that we are going to hold him accountable for. So, if you want to have that discussion with Luke Rankin, please tune in at that time. And then August the 31st, we will talk with Ms. Geraldine Gagem about the Whittemore Alumni Scholarship Program, and she'll talk more about what we're going to be doing, or actually what they're going to be doing with the Whittemore Alumni Scholarship Program. The Whittemore Community Magazine and Whittemore Alumni Association are are different entities, but of course we're all family, so to say, because of the Whittemore roots. So the Whittemore High School Alumni Association gives scholarships away every single year, and she's going to talk about that initiative and what they're doing. And then Dr. Mack, if all goes well, we should have someone from Horry County Schools joining us next Friday. Okay. I reached out to them and to talk about the decisions that have been made over the past week about returns to school. And more importantly, there was some information that was released today about the Horry County School LEAP program. And I don't know how many people are aware of it, but on August the 20th, classes will begin for about 2,500 students in Horry County. It's going to be a pilot to program, kind of testing the waters on returning to in-person instruction. And there's a lot of questions surrounding it. So it's better for us to get the information from the horse's mouth. So I've reached out to Horry County Schools and trying to get some confirmations for a special guest for next Friday. So we'll see, and we'll put a promo out in time to let everyone know.
Okay.
All right.
I see a couple questions here, and I'm gonna kind of hit those real quickly. Okay. My dear cousin, Vonda Cookie Vandross Brown family. She asked me, I do have a question. You may have addressed it before, but how often should you get tested? Okay, that's a good question. You certainly want to get tested if you have any of the symptoms. Okay. The second thing is you want to get tested if you're in close proximity to somebody who has tested positive. Again, less than 6 feet, more than 15 minutes. But the frequency and how often to get tested, that's a good question. And a lot of that depends on those two things that I just named, plus how you feel. I mean, if you've got any symptoms to where you think, okay, I'm not feeling right, something's not right, and any of those classic symptoms that we talk about with COVID, any of those, then you should get tested. Now, here's the thing to that is once you test positive, you have to be careful how frequently you get tested after that, because there's some people that are saying, well, I've had COVID 3 times, but they've tested 3 times in 3 weeks. And that's probably the same positive test from the first time. So again, the frequency with which you're testing just depends on the symptoms you're having, contacts you've been around, your risk of chances of having it, and that kind of thing. Okay. So I hope I answered that question. Another question from my good brother Carl Watson in Columbia, asking about and then we talked already about the schools reopening, but I think he was also asking about colleges and athletics opening up. And what's happening is, as we see, there's 5 major colleges in football, and 2 of them have decided that they're not going to play college football this year. So what happens is what's happening is, even, what colleges are doing and are still planning on doing it, is we're kind of putting these young people in a bubble. In other words, we're tracking who they're with, how long they're with them, as best as we can. If this is your group that you're assigned to be with, that's who you need to be with. These people are being tested in groups, and they're being handled based off of the results of the test. But when you know you've got a quote unquote bubble, then you feel confident. For the last 2 weeks, my daughters have had their best friends staying at our house. Okay. However, before they could come, they were quarantined, isolated at their house for 2 weeks.
Mm-hmm.
I've got my kids and my wife call me the COVID police. So before they could come and stay, they had to pretty much be out of circulation for 2 weeks. Mm-hmm. And once their parents assured us that that was the case, they've been at our house for 2, maybe 3 weeks now. It's okay. I'm fine with it. Because they're in a bubble. And that's what we're talking about. Because the thought was, and these articles have been coming out, on the mental health side of things, with these kids not being able to socialize with their friends. So the CDC, Dr. Fauci came out with some stuff talking about creating socialization bubbles. Mm-hmm. But you have to have the understanding with the parents that you're going to bubble your kids with, that they're doing their part prior to the kids getting together. Mm-hmm. And so I felt comfortable. I know the family, of course, well. They're some of my best friends. So I felt comfortable that what their mom and dad were telling us was the truth. Mm-hmm. After that 2 weeks passed, they've been at my house for about 3 weeks. I'm okay with that. It's fine. Mm-hmm.
Well, and again, it goes back to doing whatever is necessary. You got to make sure everybody's protected all the way around. So, and I know a lot of parents have been struggling with the socialization issue for their young people because they're missing so much from not being able to do it at school. So, if this is a very necessary part of their development and engagement, and you're finding that it will make them feel more at peace with the situation and make it easier in terms of coping skills, then hey, make it happen. Especially since they're getting ready to go to school, and there's no telling how the restrictions that they're going to have, from either the virtual learning environment or the hybrid environment is actually going to play into everything since it's been happening for so long.
Yes.
So,
yes.
Mm-hmm. Yes. All right. Well, Dr. Mack, I think we can look over our social media threads and see if there's any more questions. Of course, if you have any questions, please post them now. Also, I have a reminder here that the cemetery cleanup in Bucksport is happening on August the 22nd. They're still looking for volunteers and donations. And when I last spoke with Kevin Mishu, basically he said, the awareness was heightened from his appearance on Whittemore Community Magazine. And so we don't want you to forget about the project. If you can, help out as far as the cemetery cleanup is concerned, not only will it be, a great give back to that community, but you may learn a lot about some of the people who are buried there and the families that are actually connected to those burial grounds. So, and I'm sure that they have created some precautions and measures to make sure that everyone remains safe while they're doing it. So you can be in touch with Kevin Mishu. He is on Facebook, or his wife, Gina Mishu, or you can send me the information and I'll be sure to get it to them as well. But anyway, Dr. Mack, is there anything you want to leave everyone with as far as final words going into the weekend?
Well, again, I always want to leave on a positive note. I want to make sure that I'm spreading facts, not fear. Worldwide, in the last week, the number of people that have recovered have gone from over 12.5 million to over 14 million worldwide recoveries. In the United States, in the last week, the number of recoveries have gone from 2.5 million to 2.8 million. And in South Carolina, the number of people that have recovered have gone from about 33,000 to around 42,000. So again, doing the right things, doing them the right way can definitely make a difference in this. Mm-hmm. Our state epidemiologist, Dr. Bell, has said that. I don't know her personally, but I've had a chance to meet her, and she seems like an upstanding person to me, and I trust her as well. And she was in a tough situation. Mm-hmm. And I think some of that has come to light this past week with what was going on. Likewise with Dr. Fauci. I mean, again, when you have a job, but your quote unquote boss is kind of saying some stuff that's opposite, at a certain point in time, it's the oath that we took to first do no harm. It's the oath that we took to make sure that we're protecting the communities and the people that we took an oath to take care of. And this is a public health catastrophe.
Mm-hmm.
Again, over 171,000 people have died. We're on a pace for over 225,000 deaths, if not more. Again, we're a good 6 to 8 weeks away from the start of cold and flu season.
Mm-hmm.
We're really about a month away from really these colleges that are meeting in person, really getting into the bulk of people being on
buffering a little bit
on these college campuses, consistent from any kind of scholastic sports events. And all these things have to be taken seriously. I mean, there's no bigger sports fan than me. There's no bigger person that wants to see sports on than me. I can't think of anybody that likes sports better. But I'm concerned that if we have this lax attitude about social distancing, physical distancing, mask being worn, that this will be a major problem. And this has the potential to hit over, I've seen some models that said over 300,000 deaths before the end of this year. It's hard for me to wrap my mind around it, but we're hitting over 1,000 a day pretty much for the last 3 weeks. So, I mean, we're just early, we're mid-August. We got September, October, November, and December.
39 days till fall, I believe, something like that.
We got 4.5 more months in this year. We got 4.5 more months. So if you're saying 4.5 more months, that's what 120. What I mean, I don't even want to do the math because the math is staggering. But again, the truth is that these numbers are there. These numbers are real, and please protect yourself, people. It's not just old folks that's dying. It's not just sickly people that are dying. This virus has no affinity to one group of people.
Right, no respect.
We are seeing some people that are dying more often than others, and there's a lot of different factors for that. I think we talked about that probably early on. Medical deserts. People that, that have these medical problems, but they don't necessarily have the best access to healthcare. So hence, their diabetes is probably going to be uncontrolled. Their sleep apnea probably hasn't been diagnosed, or if it's been diagnosed, they may not be wearing the machine like they should. People aren't taking their asthma medications because they've got to decide whether they're going to take their asthma and COPD. I'm sorry, I've been talking all day. COPD medication or pay their bills.
That's right. That's true.
So, and that's real. I hear that all the time. I've been seeing patients now for almost 30 years, and the same things are still talked about. Access to healthcare, affordable healthcare, affording medications to take care of yourself. And again, we haven't even been through a winter of known COVID-19. It probably was here last winter to some degree, but we haven't been through a true winter with people testing positive.
Exactly.
So we don't know what that's going to look like. I'm very concerned. I can tell you that. Most people who have sensible minds should be very concerned. So, again, please protect yourself, protect your families. Again, if you're wearing these masks that have these vents in them, throw those away, because you're pushing particles out, but you're preventing it from coming in. It's a one-way valve. It's a selfish mask. If you don't know, now you know. Okay?
Okay.
So again, be careful, be vigilant, be good stewards to your community, good stewards to your family, good stewards to everybody that you come in contact with.
Absolutely.
Okay.
Well, thank you so much again, Dr. Mack, for being with me this week. And we also want to thank the Emmanuel Nye Memorial Foundation for being our live stream partner. And I say partner because we are streaming live on their Facebook page as well. So thank you so much for tuning in and watching us over the past 3 weeks. We certainly do appreciate you helping to distribute this information to those who need to know it, and to try and keep everyone safer. So we'll be back next week, Dr. Mack, as we always say, if God willing and the creek don't rise. We'll be here. We'll be here with updated information, explanations from our trusted source, and hopefully a special guest or two. So we'll see. But everyone have a very safe weekend, and we'll see you next week. Oh, check us out on Whittemore Community Magazine on Monday. Again, the genealogy talk with Grant Mishu. So thanks so much. Appreciate all of you for watching.